If we just do a little bit of context first of all, so you know a little bit about Southwark and what the challenges are, etc., before we go into the Homeless Reduction Act and the partnership work that we've been doing with health agencies, etc. So Southwark historically has always had a large homelessness problem. We have the third largest homelessness applications in England. Birmingham, with a population of 1.2 million, has 5,000 applications. Manchester, population of about 500,000, has 3,000 applications, and then it's Southwark. So it's always been a service that's been highly used by customers. So each year we see around about 22,000 customers at my office giving housing advice, prevention work, etc. However, considering we're a central London authority, we've always said that prevention is at the heart of everything that we do in terms of prevention of homelessness and also partnership working. However, that prevention is becoming more and more difficult to achieve because of the welfare reforms that has recently been introduced. So within Southwark, a person under the age of 35 can claim £95.18 per week towards their rent. However, the average rent for a one-bedroom property in Southwark is £480 a week. Now, I'm from an area of the country, as you can tell from the accent, from the northwest, where my brother lives in private rented accommodation, pays that a month for a two-bedroomed house. So the economics in London are stacked against customers who are perhaps on the fringes of employment or have poor health or poor educational attainment. And universal credit was introduced within the whole of Southwark 18 months ago, which has not worked very well, if we've got to be honest with you, in terms of it's been very difficult to work within that framework. The council's lost several hundreds, thousands of pounds of lost rent, because if somebody's in temporary accommodation, the universal credit framework is very, very hard to achieve any rental payments at all for people in that temporary accommodation. And in addition to that, as you're all aware, on the 3rd of April, the government will be introducing a new Homeless Reduction Act, mainly aimed at prevention of homelessness, and we've been trialling that for central government since October 2016. So we're the only council in the country to have done that type of work, and we've been actively trying to eliminate the use of bed and breakfast accommodation. So as at the 1st of April 2017, we had 326 families with children living in bed and breakfast accommodation. 181 of those was living in bed and breakfast accommodation for over 6 weeks, which is the prescribed limit that the government set for families. And it wasn't because Southwark Council was suddenly rubbish, because we used to have nobody in B&B for over 6 weeks. We had always had people in B&B, but never over 6 weeks. And the reason for that was because of the introduction of universal credit and the fact that customers did not get paid the rent within the 33 days, within the 6 weeks prescribed figures. If you then kind of like look at what we've done, going from 326 households, the politicians decided to eliminate the use of bed and breakfast and set a target to get everybody out of B&B by the 31st of March 2018. And then suddenly that target was brought forward, as politicians do, to the end of November. And we got about 3 months' notice to say this is the new target. And we achieved that target just about. And since around about the 20th of November to current date, we've got no families in B&B, apart from those that may turn up today that are fleeing domestic abuse or a major disaster, and we'll put them in bed and breakfast until we can secure alternative accommodation. The last official rough sleepers count that was conducted in November, that we have to do every year, found 42 people sleeping rough within Southwark. That went up from 32 the year before, but that honestly masks a tremendous amount of work the service has been doing. So we currently have around about 119 single individuals, either in bed and breakfast accommodation, hostel or other forms of temporary accommodation, that would normally be sleeping on the streets. So that is a massive achievement that the council's achieved through its housing first model way of working. And what we have done, because we're a trailblazer council, the government asked us to train councils in terms of the Homeless Reduction Act. So we've trained every single council in England on the introduction of the Homeless Reduction Act, and we've also trained around about 300 voluntary agencies to ensure that the voluntary agencies who work with rough sleepers, homelessness customers, are also trained in the Homeless Reduction Act and how the Homeless Reduction Act is supposed to work within the country. And this has led to around about 7 councils every week visiting the service, and that's been around since September last year, and that will continue until shortly after the introduction of the Homeless Reduction Act on the 3rd of April. However, what we need to explain to you, these slides are slightly out of date. So where it says the customer satisfaction is 88%, that customer satisfaction is now 91%, because these slides relate to the end of January rather than the end of February. And what that basically shows is that the service wasn't that good, 4 years ago at all. We brought shelter in to do some mystery shopping for the council, and then we shared the mystery shopping report with the director and with the politicians and with every staff member within my service area. And the council 4 years ago was regarded as a poor quality service by shelter. The year after we increased to be a fair service, and then the year after that we was labelled as a good service by shelter. And then when they came in last year, we retained our good status, and we missed out on being excellent because we had an inadequate telephone advice service of where, because it's so busy, customers had to wait on average 20 minutes for the phone to be answered because it was always engaged. However, that's gone from a customer satisfaction level of 4 years ago of 15% to currently at 91%. And that's been achieved by placing the customer at the heart of everything we do and liaising with an awful lot of partner agencies, especially health agencies, which we'll touch upon shortly. So the 3 main reasons of homelessness in Southwark, so you're all aware, is due to parental evictions, which is 30%. It's our highest, and it's probably the highest in London, and that's probably because of the culture of the area that we work within. So the council has 29,000 council properties, largest council property in London, and in 1993 we let 7,000 properties. In 2017 we let 900 properties. So it kind of shows you the decline in lettings of affordable housing locally. But the reason that we have an awful lot of parental evictions is in 1993, when the parents kicked out their children, they were housed within days and weeks, not months. However, their parents are now kicking out their son and daughters, expecting exactly the same, of being rehoused within days and weeks. But it's taking 4 years to get somebody into affordable accommodation. 29% is due to the loss of private rented accommodation, and on average we lose around about 100 people a month from the private rented sector claiming housing benefit, because you can clearly see if the average property value in Peckham's £600,000, the average property value in Dulwich is £1 million, and somebody's renting a property, they can make an amazing amount of capital of that. So we've seen people claiming housing benefit locally reduced from 5,000 people living in the private rented sector to 2,300 today, and 12% is due to domestic abuse, which is a severe issue within Southwark. However, because of the culture change that we've introduced in Southwark, what we have determined is homelessness is not inevitable, and it can and should be prevented. And that's going to be the theme of today, that we don't believe anybody should be homeless, and we will do our utmost to prevent everybody from being homeless. However, this slide clearly shows you the national scale of rough sleeping. Basically 4,751 people sleeping rough through the official counts, a 15% increase on the year before, and basically a 169% increase since 2010. So rough sleeping is a national issue. It's increasing at a larger scale outside of London than it is in London, but the majority of rough sleepers are living in London. And this is clearly going to be an issue for every single council, health agency and voluntary agency in the future. This slide basically shows you the trends of people who are accepted as homeless, and the bottom line, as you can clearly see, is single people. So ever since 2009-10 to the latest government data, homelessness acceptances for single people have never increased, and hence why the government has introduced the new Homelessness Reduction Act in terms of making sure that every single person gets the same service. So if you are a single person who is 36 that's just been kicked out by your parents, you will now get the same service as you will if your family with 6 children presented as homeless. So everybody now going forward will have a homeless application, a personal housing plan, an assessment, and the duty on councils is to prevent everyone being homeless where possible. What the next slide shows you is increased demand for temporary accommodation. So you can clearly see this is like Southwark in terms of, you know, the side of the Everest going up one side. We're hoping it's going to start coming down the other shortly. But what this shows you is everybody in temporary accommodation has gone from around about 800 in 2013 to now 1,700 today. And the blue line is showing you everybody that's in forms of nightly paid accommodation. So that used to be all bed and breakfast, but that's been turned into private rented accommodation locally. What we then have to show you is, again, you know, some difficult statistics, which is there's 79,000 households living in temporary accommodation across England with using the last government data, and that, like we say, there's been a 6% increase in the numbers of households in TA between 2011 and 2017. So temporary accommodation across the country is not going down. And as you probably read in December, just before Christmas, Shelter's reports of over 120,000 children in inappropriate and expensive temporary accommodation. And this again is an increase of 73%. So homelessness is not going down in any area of the country. Of these households, 54,000 were placed in TA in London, 69%. So it is a problem for all London authorities, likewise with all agencies working in the NHS, etc. However, the most important thing to say there is there was a 248% increase in number of households placed in TA outside of the local authority area, which obviously means that that's a disruption to education, to health, to social well-being, breaks down communities, etc. So Southwark Council isn't proud of this, as any council should not be proud of that fact. And according to the National Audit Office, council spent 1.1 billion of its own money in temporary accommodation. So it is kind of like a major issue for councils, and this is affecting the quality of other services. So the more money we're putting in to providing accommodation temporary for homeless households is reducing the quality of other services like leisure, perhaps children's adult services, environmental street cleaning, etc. I think this slide is really, really worrying from my perspective. So if you just kind of like focus on the gold orange segments of the graph, those are the social rented properties, the ones that are really affordable to individuals. And you can clearly see the massive decline in the provision of that. And according to data produced by Shelter just in January, there's been a 95% reduction in the provision of social rented accommodation, new build accommodation by housing associations and councils, because housing associations are diversifying into intermediate rent and affordable home ownership options. So the Homeless Reduction Act, just to kind of like to ensure everybody's aware of it, if you're not already aware of it, this was kind of like a private members bill introduced by Bob Blackman, MP for Harrow, and it was a private members bill, like we say, and it went through an amazing amount of scrutiny within the select committees. A lot of local authorities were originally against the proposals of the Homelessness Reduction Act, and it received royal assent going through both parliaments in April 2017. And the government has committed £72.7 million for the introduction of that. So for example, Southwark Council next financial year will obtain £470,000 for the introduction of the Homeless Reduction Act. However, if you look at what it's costing the council to run a Homeless Reduction Act service, it's £1,534,000. So the funding provided by central government is not adequate for councils to introduce this funding. But what we need to say is we should not get bogged down by the fact that there is not enough funding there. There's never been enough funding for the NHS or the housing homelessness services. So what we need to do is be imaginative of the way we're doing our work. So the Act will be implemented 3rd of April, so not very long from now, and hopefully most local authorities are ready for the introduction of this. The new Code of Guidance, which basically explains to councils how you have got to work in the future, was introduced on the 22nd of February. So most councils and partner agencies need to start to work together of what that actually means going forward. And for example, there's a public referral framework that will be in place, and which is a good thing because it means that any public sector agency can refer into the service of somebody that they are concerned about being homeless. So for example, in Southwark, which we'll come to shortly, of our referrals that we have been getting in the last 12 months, 50% has been from the NHS, from hospitals, etc. But unfortunately, none has been from the GP practices within Southwark, which is a major weakness for the area of operation that we have. 5% have come from police, which is mainly around gangland issues in Southwark, but also domestic abuse, and then 45% from other areas. So one of the weaknesses of the Code of Guidance is it basically limits who can refer in to the housing solution services in each council. And what we were saying to the government about that is anybody should be able to refer into the service. So a Citizens Advice Bureau should be able to refer in, a third sector partner who may be providing holistic support to somebody sleeping rough should be able to refer in, not just the people that is listed within the documentation of the Code of Guidance. Basically, just to explain to everybody what the key definitions are now, is anybody that's threatened with homelessness can approach a housing needs service within 56 days or longer, as is prescribed within the Code of Guidance, where before it used to be 28 days. So a lot of councils, including my own, if somebody wasn't homeless or threatened with homelessness within 28 days, used to say go away, come back within the 28 days, which stops an awful lot of homelessness prevention, if we're honest with you. And councils have now got to accept a private sector eviction notice, which is the Section 21, if it's valid from that moment in time. Where a lot of councils used to say, come back when the bailiffs have turned up, that's no longer going to be acceptable in the future. So it will have to, if a person turns up with a valid Section 21, we've now got to try to prevent those people from being homeless. The creation of stronger advice and information is required. So the heart of everything we're doing now is the prevention of homelessness in partnership with all of the agencies that we work with. And what it has created a stronger prevention duty and eligibility for assistance. And I think this is really important for partner agencies to be aware, because the bureaucracy now involved with the Homeless Reduction Act is enormous. So anybody that's working with a homeless customer, we would be very happy if anybody completed the personal housing plan and referred that customer to my service, because then we would be able to work with that individual, stop them sleeping rough, etc. So my council has a policy that anybody turns up to a public sector agency that's threatened with rough sleeping that night, they will not sleep on the streets that night. We will provide them with emergency accommodation, that may be B&B, and then move into a hostel or to self-contained, a private rented property. Likewise, any single female fleeing domestic abuse in Southwark, we accept they're not going to be in priority need. What was the old need of the 1996 Act will also not go back to the perpetrator of domestic abuse. They'll also be accommodated in that accommodation. And the referral mechanisms we've introduced with health has been really, really positive. It's helped to reduce bed blocking. We've guaranteed that we will see everybody that we receive a referral from within 72 hours, and that's either from the hospitals or the mental health hospitals that are within Southwark, to ensure that that partnership work continues with everybody. We've done massive amount of training within the health service, so I went and trained all of the midwives within the midwife section of the hospital, because the really concern that we was having is somebody's pregnant, doesn't want to tell their partner or their mum and dad, at least the person that they're seeing for the first time is probably the midwife. They can give them proper advice of assistance of where to seek our services from. And what it basically says here is that we must take reasonable steps to secure accommodation regardless of priority need, because in the past, single people never really got a service from a majority of councils. We've got to be honest about that. My council being one of them, we gave them basic advice and assistance, a leaflet that says go and try to provide private rented accommodation, and now what we're doing is actually preventing their homelessness with the provision of accommodation, mainly in the private rented sector. But what that disguises is, because of the local housing allowance rates within Southwark, we can only house 29% of homeless people in private rented accommodation in Southwark. The other 71% are housed outside of Southwark. But those customers are housed in an area of their choice. We're not one of these London councils that will say, you're now moving to North Norfolk or to Birmingham. If you don't accept this property, you will discharge our duty. We're not like that. We will work with the customer, find out if they've got friends and relatives in any area, and see if we can move that customer to that particular area. So what this basically Homeless Reduction Act is encouraging us is to work as prevention, relief and in partnership with everybody. So our homelessness forum consists of 50 agencies. The NHS is one of those key partners within that, and they really do challenge the work of the Housing Solutions Service, which chaired by an independent person who probably is one of the most critical organisations of the council in terms of the work, and we wanted to have that to make sure we was honest and transparent. Also what it does is it introduces judicial reviews on a much larger scale. So at the moment when the Act comes into place, a customer can request a review of any decision or any action by the council on 17 separate occasions through their journey. This is increased from 2 in the previous regime. And what we are doing is collecting that customer journey in order for us to monitor how successful we are with the services that we're providing. We've brought Homeless Link in to actually work with us, which is a national organisation, to organise customer focus groups, because even though the self-certified 12,000 people that says they're satisfied or very satisfied with the service on a computer system, we don't actually believe that data, or I don't. So we've brought in Homeless Link to do independent customer focus groups. And what we have to do is to ensure that all options to prevent homelessness are explored. But clearly, to try to prevent homelessness of somebody fleeing domestic abuse would not mean go and return to the perpetrator. That would mean getting the person out of that accommodation and preventing homelessness by providing alternative accommodation. What this data shows you is quite remarkable, because Southwark may have been accused of being arrogant or whatever, but we was thought we was one of the best housing solution services in the country. However, we've now realised, of operating the Homeless Reduction Act service, how bad we were in the past. So if you look at the data, power off, to carry on. So if you look at the data, it will basically show you that there's been a 49% reduction in homelessness acceptances. And the reason why there's been a 49% reduction in homeless acceptances is because that prevention work now kicks in at a much earlier stage in life. And homeless acceptances have reduced from 40% to 34%. And these homelessness reviews we was talking about, where we made 2,400 decisions a year ago, we had 579 reviews. That's now been halved because the customer journey is much more positive within Southwark. However, what this has produced is additional work for officers working within the service. So the average time we used to make a homelessness decision in the past was 24 days. We was very efficient about making those decisions. However, each case officer had 15 cases per any point in time. They're now the customers with the service for 150 days because we're trying to prevent them all of the time from being homeless. And that's resulted in every officer now having 70 cases per officer. And this is what's going to be mirrored probably across the country. And the last section just shows that we have nobody in bed and breakfast accommodation, which is really important for the council. What we obviously have to say to you is that the culture change within the service has been dramatic. So what we did, as we said, with Shelter, they've been undertaking independent mystery shopping and quality audits on us. What we've now done is we've seen a 29% increase in customers accessing the service, and that's either through referrals from partner agencies or direct approaches. And what is positive now for the council is 40% of all of our customers are single homelessness, and all of those are now being treated exactly the same way as a family with 6 children or however many children they have got. We've already talked about the local housing allowance framework not helping anybody at all to prevent homelessness, which is a fact, especially within London, but also across the country. And the government funding isn't adequate, but what we need to focus on is what we can do within that funding stream. What will be happening going forward is partner agencies will have to be involved in the design of services, and it's important that councils design the IT systems to follow the processes of the partnership working they're doing with health and third sector partners. What's not appropriate is to buy an IT system or configure an IT system that basically the IT provider has provided to you, and you have to work within that environment, because it then doesn't become human and it doesn't place the customer at the heart of everything we've done. So every single officer within the service has now got a new job description. Everybody that's working on the Trailblazer has had a permanent pay increase, and that's rightfully so, because the job descriptions have changed dramatically. They're no longer working on the basis of the computer says no. It's working on the basis of we're here to prevent your homelessness. It's an honest and open discussion. And all the JDs talk about you will take risks, you'll be innovative, you'll be dynamic, rather than what it used to say in the past, you will follow the 1996 Housing Act. It is honestly a 100% different way of working within the service, and partner agencies have recognised that. Some partner agencies that we work with dislike the council tremendously. So when I walked in the door 4 years, 10 months ago, they used to email saying, we hate your service for these reasons. Now what they're saying is, we actually can't believe how great that customer journey is, but we still hate you because you didn't place the customer in council accommodation. And the reason why is because there is no council accommodation to place a customer within. So what we did was we introduced 14 personal housing plans. So a woman fleeing domestic abuse will have a personal housing plan directed that's reasonable to a woman fleeing domestic abuse. A person that is being evicted by mum and dad will have a separate personal housing plan that will ask separate questions that will be relevant to those individuals. So what we've tried to do is make it customer focused. We work with our partner agencies for them to design the personal housing plans, and with the customers as well, to ensure that it was customer focused. But probably some of the biggest things and best things we've done is we introduced shelter into our housing solutions service. So they now work within the housing solutions service reception area as independent advice and advocacy. And if a customer is not happy with the quality of service from my team, we will just direct them to shelter, who will then advise them and provide advocacy and challenge the council where that will be. And that's a 5-day-a-week service. We have 3 officers, and we also have Skype facilities. So if a customer can't get into the office, they can Skype shelter to ensure independent advice and advocacy is provided to them through either being in a library or mobile phone, tablets, etc. And because domestic abuse is so large within Southwark as an issue, we now have Solid Women's Aid working again within the Housing Solutions Service 5 days a week, again advising and providing advocacy for women fleeing domestic abuse. So what we have done is we've built up this corporate commitment within the council. So it is now really important, the Homelessness Reduction Act and the homelessness work. So for example, the leader of the council enforced compulsory training for all of the elected members in terms of the Homelessness Reduction Act and the council's work. And that training was spread over 10 days for the ruling group, which is the Labour group, and we had 2 training sessions for the Liberal Democrat group as well. What we need to focus on is what we were saying before. Do not get bogged down within the bureaucracy of the Homelessness Reduction Act. And it's important that any agency in here refers to any council's housing needs service, because that will then allow councils to prevent homelessness. That may mean voluntary sector agencies, public sector housing associations, and so on. And partnership working is really important. We could not have done what you've seen, a 49% reduction in homelessness acceptances, without the partnership work of people from the health, third sector agencies, etc. Every council has got to produce a homelessness strategy, and it's important for agencies in this room to help to shape and design that homelessness strategy. So our homelessness strategy has been to the Homelessness Forum now on 3 separate occasions. We've consulted for the last 9 months on it to ensure that it's not the council's homelessness strategy, but it's the partner agencies we work with, so the NHS and everyone else. And any agency can complete and support a customer with a personal housing plan. This personal housing plan is the first step that basically shows what the customer's needs are and what they want from my service or from any service across the council. It is important that any agency in this room can complete those and send them in, along with a referral to any particular council. What is also important is training. So we've trained a lot of our partner agencies, well, most of them, if not all of them. So we've trained them on 3 separate occasions within the last 12 months. And in addition to that, we've trained and trained staff for the last probably 52 weeks, every single week, because the culture change between the 1996 Act and the 2017 Act is enormous. Where before, councils was accused of gatekeeping, etc. Now it is sitting a customer down and saying, how can we now assist you from preventing you from being homeless? One of the best things and biggest things we probably did was the recruitment of 16 apprentice officers, and the majority of those had a lived homelessness experience. So what that means is people were sleeping rough, sofa surfing or homeless, and what that's made us do is be more empathetic with the customer that accesses our service. It's also brought the average age down within my service, because what you've got to remember is in a lot of councils, a lot of officers within housing needs have been working there a long time, and what this has done is brought this new energy and dynamic approach, and also an understanding that we perhaps didn't have in the past through this lived experience. What we've also decided to do is not to recruit anybody that's got a previous knowledge of 1996 Act, because our experience of training our staff has been really difficult, where you send them on a training course, they say they get it, they come back, and within a couple of days they've lost what they said on the training course, and they've gone back saying you're intentionally homeless, when actually there is no intentional homelessness anymore. What you're trying to get at, and there is no priority need, you're trying to prevent the homelessness, and that's been really difficult for my council, if I'm going to be honest with you, and it's resulted in probably about 5 officers having great difficulty. Depending on what you think of the service, we don't believe in giving up on any of our staff, but we've now mentored them, coached them, we've got the independent coaching from Shelter, and they're still finding it difficult to provide that new service that we're proposed to be providing. We've trained 100% of elected members, like we said. That includes the MPs' officers, and all councillors, because it's really important for everybody to understand this. We've introduced a vulnerability pathway plan, so that ensures that no rough sleeper or single person falls through the safety net. And that is linked with all of the leaflets, the training, the personal housing plans, etc. The customer empowerment and choice is now placed at the heart of everything. So before, we used to find accommodation and then ask a person to move into it. We're now saying, where would you like to live? And we look for accommodation in that area. So it is placing that customer in the driving force. What we're also doing is we're trying to do upstreaming work. So we're liaising with health agencies in hospitals at the time the person goes into the hospital, not the time of the discharge, because then we'll be able to work with those individuals in a far better way. Also, what we've been doing is we've been visiting people affected by the universal credit and going to upstream them, because we believe their landlords will be evicting them. We have self-help packs for homelessness prevention, accommodation finding services in areas that you want to live. We've changed the leaflets, so anybody working in local government will know the Section 184 letter, which is the letter that says we're either going to accept you or not going to accept you. In Southwark, that's 17 pages, and only 2 people understand the contents of it, the caseworker and the solicitor acting on behalf of the customer. That's now been changed to make it much more easy to understand. And we have honestly got excellent partnership working arrangements. So every one of these agencies is either based within Housing Solutions, or we have surgeries in the offices. So the Job Centre Plus, we go there every Thursday to provide a housing advice, job creation service. Some Mungos are based within our service, NHS. They refer into us electronically. We've trained their staff in terms of the discharge people. South London Maudley Hospital, which is basically a hospital for people with mental illness, are embedded within the service. Solitary Women's Aid are based in it, Shelter are, and every one of these has access to us electronically or are based physically within our service. Obviously, some agencies are more important than others, so like London Probation Trust are really important, but too busy to come and sit in our office, so we go and do our surgeries in those offices. So like we said before, 50% of referrals come from the NHS, but nobody from the GPs, and that's a major weakness within Southwark, if I'm going to be completely honest with you. 5% from police. We don't have any surgeries in any of our health agencies, which we'd like to do within the hospitals, etc., to provide that advice, but we do in all the other areas. And we have Saturday surgeries now, which is within my office, that brings people in, targeted campaign to try to prevent the homelessness. And like we said before, we've trained everybody in terms of what we're doing, and 91% customer satisfaction of the 12,000. What is going to be important for partner agencies in this room is that you'll need to assist councils to change the culture, and you need to challenge those councils. And what we have done within Southwark, because there isn't enough funding, like there isn't enough funding in most public sector agencies, we've amalgamated the homelessness prevention grant, the flexible homelessness support grant, the new burdens funding, to provide a brand new service. We're committed to recruiting at our own through Grow Your Own. You do not need to have homelessness experience to work in my service. What you do need to have is an empathy with the customer and this aptitude to develop yourself to provide the best customer quality services that you can. What we then need to focus on is it's really important in terms of training staff, as we said before. So 5 of my staff are really struggling with this Homeless Reduction Act. We've trained them. They still don't get it. One person is been removed from frontline duty because their habit-forming approach of 1996, that mentality, means when they used to go into work, they knew what cases was going to be IH, non-priority, that we didn't really provide a customer quality service, and that's now changed. So the partnership working cannot be emphasised enough. The health service within Southwark in terms of the hospitals has been really positive with Southwark. The work with our other partner agencies, with probation, police, etc., has been fantastic, and all of those other agencies. We're not saying we're perfect. We're constantly learning and developing of what we're doing. So 91% satisfaction is the highest we've ever had. If you look at the staff profile within the service, you may think we're a barking mad service because of the constant change we're going in, but the service had the second highest staff satisfaction from the annual staff opinion survey that we recently conducted across the council. And the partnership working has to happen. So from anything that you're going to do from today, the one thing I would say that you have to do, you can by all means contact me, visit us and walk through our service, we haven't got a problem. But everybody in this room has got the ability to change the way councils provide their homelessness services. And councils truthfully have to change the way that they provide homelessness services. So we're no longer a gatekeeping, we are no longer focused on the computer says no. What we have to be focused on is the prevention of homelessness, putting the customer at the centre of everything we do. And everybody in this room is a leader. You may not think you're a leader, but you actually are a leader within your agency. You have the ability to change the way your organisation interfaces with councils and change the way you're working with homeless customers. So the one thing I would say that you would need to do following listening to me today is please go back, challenge the Housing Needs Service and Housing Solution Service to provide that true customer focused approach, work in partnership with those agencies. But whatever you do, focus on the individual as though that individual, that customer in front of you, was your mum, your brother, your sister, and provide a true customer-focused service to prevent that individual from ever being homeless in the future. And that's the challenge that we all have to face on a daily basis, to change the world for these individuals, because at the end of the day, you're more important to them than you'll ever recognise you to be. And consequently, what we need to do is to change the world for those individuals that perhaps do not have other options, and that's down to you and the agencies that you work with. So good luck going forward.